The ER doors exploded open. We need to get him to screeching against tile. "He's not breathing!" someone shouted. A Navy SEAL lieutenant, ribbon still fastened to his shredded uniform, lay motionless beneath the unforgiving white lights. Monitors shrieked while physicians barked commands. Then came the words no SEAL body should ever hear. Time of death. But at the chaos's edge, one nurse didn't budge. Arya Lockhart, composed, motionless, observing. She stepped forward, her voice subdued but resolute. Not yet. Before anyone could halt her, she executed a maneuver no civilian hospital had witnessed. Something birthed on a battlefield, not in a classroom. Gasps saturated the room as the flatline trembled. Then a heartbeat returned. The chief surgeon froze. "What did you just do?" Arya raised her eyes, steady, tormented, something I vowed I'd never employ again. If you believe heroes never truly cease serving, hit subscribe, because what she did next would expose a secret the Navy entombed 12 years ago. The ER at St. Gabriel Trauma Centre was already operating on vapours when the transmission arrived. Rain hammered the windows. Thunder rumbled like artillery fire outside, and the scent of antiseptic and scorched coffee saturated the air. But when the voice crackled over the radio, tense, abbreviated, urgent, everyone froze. "Critical inbound, male, 38, multiple gunshot wounds, unresponsive, no pulse for 2 minutes, possible Navy SEAL unit insignia on uniform." Nurse Maya Whitaker was already moving before the transmission concluded. Her gloved hand snapped tight, her voice slicing through the noise. "Trauma 1, clear the airway cart. Get me a thoracostomy set and pressure infuser now." The charge nurse blinked at her. "Maya, you think we'll need—" "Yes," she stated flatly. "And bring the crash cart. He's not done fighting yet." The automatic doors slammed open a minute later. Rain and chaos poured in with the paramedics. On the gurney lay a Navy SEAL lieutenant, uniform shredded, chest soaked dark, eyes half open but unseeing. His ID tags clinked against the rails as they wheeled him through. "Lost pulse in transit," one of the EMTs barked. "We tried compressions." No rhythm. "Push 2 of epi," shouted Dr. Ethan Marlowe, the attending surgeon, rushing in behind her. "Get ready to call it." Maya's head snapped toward him. "Call it?" Marlowe didn't even look up. "No vitals for 4 minutes. We've done what we can." She stared at the monitor, flat, unwavering. The room seemed to shrink around her. Then, quietly, she said, "Not yet." Marlowe frowned. "Nurse, stand down. That's an order." But Maya didn't move. Her eyes had gone distant, focused somewhere far beyond that sterile room. She saw not the hospital, not the doctors, but the memory of a tent under desert stars, where the air smelled of cordite and diesel, and the cries of wounded men never stopped. In another life, another war, she'd stood over operators whose hearts had stopped, and she'd brought them back, not with hope, but with hard, brutal skill born of desperation, the kind that never made it into textbooks. Her voice was low, controlled. "I've seen this before. You're missing the secondary collapse. The internal cavities are locking his rhythm." Marlowe's expression hardened. "You're a nurse, not a trauma surgeon." Maya stepped forward anyway. "You want to watch him fade? Fine, but I'm not letting another SEAL die on my shift." The team hesitated, torn between hierarchy and instinct. Her tone didn't ask for permission. It gave direction. She leaned over the gurney, eyes locked on the lieutenant's pale face. "Hang in there, sir," she whispered, her hands already moving. "Somebody get me 10 cc of atropine," she said sharply. "Prep the left thoracic cavity." Marlowe started to protest, but the paramedic beside him muttered, "Sir, look at her hands." Everyone did. Maya's movements were surgical, clean, exact, practiced. the kind you didn't learn in civilian hospitals. Her voice dropped lower as she pressed her fingers against the rib line, searching for the hidden point. This isn't cardiac. It's pressure lock from a pneumothorax. He's suffocating inside. Marlowe hesitated, then snapped. Fine, do it. You're responsible for the outcome. She already was. Maya made a small incision, guided by instinct more than vision. The room held its breath. Seconds dragged. Then a hiss. A long, desperate rush of air escaped the chest cavity like a sigh from the edge of life itself. The monitor flickered once, then again. Beep. A faint rhythm crawled across the screen. Beep. Beep. Marlowe froze. That's impossible. Maya's tone was quiet, almost reverent. No, Doctor. It's experience. For a few seconds no one moved. Then chaos reignited. Orders flew, fluids ran, vitals rose by the smallest of margins. The Navy SEAL was alive. Barely, but alive. Marlowe turned toward her, voice shaking between awe and disbelief. Where, in God's name, did you learn that procedure? She peeled off her gloves, eyes distant again. A place that doesn't exist on any map. He blinked. What does that even mean? Before she could answer, the intercom blared. Incoming medevac, 2 minutes out. Same convoy, multiple criticals. Maya's head jerked up. Get him to ICU. I'll take the next intake. Marlowe stared at her. You should be off shift. You just pulled a miracle. Her lips pressed thin. I'm not done yet. Outside, thunder rolled again. 2 minutes later, she was back at the entrance as another gurney came flying in. This time carrying a Navy corpsman with shrapnel embedded along his side. Blood seeped through the gauze. His breathing was shallow. Maya leaned over him. Stay with me, Doc. His eyes fluttered open just long enough to see her face. You were there, he rasped. Kandahar, SEAL Team 6, the doc who never missed a cut. Her heart clenched. Marlowe, standing nearby, froze. What did he just say? But the corpsman was already out cold. Maya straightened slowly, her expression unreadable. He's delirious, she said flatly. Get him to OR. Marlowe's gaze lingered on her. He called you Doc. She met his eyes for the first time. I told you, Doctor. I've done this before. He stepped closer, voice quieter now. Who are you, really? Nurse Whitaker. But before she could respond, the first lieutenant's monitor upstairs began to alarm again. Irregular, unstable. ICU's paging you, shouted a resident. Your patient's crashing. Maya didn't hesitate. Keep him alive, she ordered the trauma team. I'm going up. As she sprinted down the hall, her mind replayed the voice of her old commanding officer. The last words she'd heard before leaving Afghanistan. You save who you can, Whitaker, but don't let the ghosts follow you home. They had followed her anyway. When she burst into the ICU, the SEAL's monitor was in chaos. Nurses hovered helplessly. Marlowe was seconds behind her, panting. He's going into full arrest, he shouted. We're losing him again. Maya didn't wait for an order. She moved straight to the bedside, grabbing the syringe from the crash cart. Not today, she muttered. Her fingers were steady, perfectly steady, as she injected, repositioned, and started compressions again, counting under her breath like a prayer. The seconds stretched. The line on the monitor held still. Then a faint flicker. One beat, then another. The room exhaled in disbelief. Marlowe stared, his voice barely a whisper. That's twice now. You've brought him back twice. Maya leaned back, sweat glistening on her forehead, eyes clouded with emotion she'd long since buried. Sometimes, she said softly, you just need to know where to look for a heartbeat. He looked at her like he was seeing her for the first time. You weren't just Navy medical, were you? Her answer came quietly, almost swallowed by the hum of the machines. No, she said. I was SEAL Team 6. And before he could speak, the monitor spiked again. A new rhythm, stronger, louder. She turned toward the sound, her expression unreadable. Get the surgical suite prepped, she said, her voice calm as ever. This fight's not over yet. Outside, the storm raged harder against the glass, lightning flashing through the window like camera shutters, catching the look on Maya Whitaker's face, the look of a soldier who had stopped running from what she was. If you believe heroes can rise again when the world has already given up, comment, never give up. The ICU hummed with low light and quiet dread. Machines blinked in steady rhythm, but no one in the room relaxed. The Navy SEAL lieutenant, the man who died twice and lived twice, lay pale under sterile sheets. His skin carried the grey hue of exhaustion and shock, the kind that didn't come from wounds alone. Dr. Marlowe stood at the foot of the bed, arms folded, eyes locked on the monitors. The numbers held steady, but his focus wasn't on them. It was on her. Nurse Maya Whitaker stood opposite him, methodically checking vitals, her gloved fingers moving with precision that felt unnatural. Not robotic, practiced, trained, refined by something more than hospital routine. Finally, he broke the silence. Who are you really, Whitaker? She didn't look up. I'm the nurse who just kept your patient breathing. That's not what I asked. His voice dropped. You performed 2 emergency procedures without authorization, both outside your certification, and you did them flawlessly. That's not luck. Maya straightened slowly, her expression calm but unreadable. I don't believe in luck, Doctor. Just timing. Marlowe's jaw tightened. You're going to have to do better than that. Before she could answer, the door swung open. Dr. Arjun Desai, the chief of medicine, entered with a clipboard in one hand and the weight of authority in the other. His eyes moved from the SEAL to Maya. You two. My office. Now. The words carried no room for negotiation. Desai's office was a glass box overlooking the ICU. From here, you could see the storm clouds thinning. Outside, dawn beginning to push against the night. But inside, tension hung heavier than the humidity in the air. Marlowe paced near the desk while Maya stood still, her hands clasped behind her back, her posture too straight for a civilian nurse. Desai set his clipboard down and spoke first. 3 hours ago, a Navy SEAL lieutenant arrived clinically dead. Twice. He's alive because of you, Nurse Whitaker, but you also violated multiple surgical protocols. I did what needed to be done. Marlowe shot her a look. You inserted a chest tube blind, then revived him with an off-label dosage. If you'd been wrong, I wasn't wrong. The firmness in her tone made him stop mid-sentence. Desai exhaled, leaning back in his chair. We're not here to debate skill. We're here to understand it. Where did you learn to do what you did tonight? Maya hesitated, her gaze flicking to the window. The rain had stopped, but the world outside still looked grey. Overseas, she said finally. Which base? Her silence was the only answer. Marlowe's frustration broke. You're not just some field nurse. I've worked with Navy Medical, I've seen their training. But what you did... He stopped, studying her. You weren't just Navy. You were the Special Operations Medical. The air in the room seemed to drop 10 degrees. Maya's jaw tightened. That's classified. Desai blinked. Classified? You realise how that sounds in a hospital setting? I realise how it saved your patient. Marlowe stepped forward. I looked up your file. You transferred here from a private care facility in Virginia. Before that, nothing. Just a gap. 5 years missing from your record. No references, no history. You don't vanish for 5 years unless you're hiding something. Maya finally turned to face him fully. Her voice was calm, but there was an edge beneath it. I'm not hiding, Doctor. I'm surviving. Before Desai could respond, an alarm blared outside. Not the shrill of machines, but the deep, bone-shaking wail of a hospital emergency alert. Mass casualty inbound, came the announcement over the intercom. Multiple gunshot victims, ETA 5 minutes. Desai was already moving. We'll finish this later. But Maya didn't wait for direction. She was halfway down the hall before anyone could follow. The ER erupted again. Paramedics pushed through double doors with stretchers in tow. Civilians, security guards, even a firefighter. Victims of a downtown shooting. Blood, panic, and adrenaline filled the air. 3 criticals, 2 stable, a medic shouted. We've got penetrating trauma to the abdomen on the first one. Marlowe took the lead. Trauma 1, open and ready. Whitaker, with me. She didn't argue. The moment her hands touched the patient, her focus narrowed. Noise faded, motion slowed. Every breath, every movement became part of a rhythm she hadn't felt in years. The battlefield rhythm. Entry wound, lower right quadrant, she said, eyes scanning, voice clipped. Pressure's low. Bleeds internal. Marlowe nodded, moving for instruments. We'll have to open him up. Not yet. He frowned. Excuse me? Maya pointed to the ultrasound. You open him now, he bleeds out before you can isolate the source. We need to clamp the inferior branch first. He hesitated. You can't be sure. I am sure. Marlowe stared at her, then at the patient, then at the readings. Against his better judgment, he followed her lead. Within seconds, the bleeding slowed. How did you... She didn't let him finish. He's stable enough for surgery now. Move. As the gurney rolled out, Marlowe caught her wrist. Not hard, but firm. His eyes locked on the faint mark just visible beneath her sleeve. A symbol. The SEAL trident. Small. Discreet. He let go. I know what that is. Her expression didn't change. Then, you know why you should forget you saw it. He didn't answer, but she could see the gears turning behind his eyes. Hours passed before the ER quieted again. The survivors were in recovery. The dead had been wheeled to the morgue. Only the hum of fluorescent lights and the hiss of oxygen tanks remained. Maya sat alone in the break room, elbows on the table, coffee cooling untouched in her hands. For the first time that night, she looked tired, not from work, from memory. Her mind went back to the Gulf, the heat, the sand, the sound of rotors chopping through smoke. She remembered kneeling beside a fallen SEAL, her gloves slick, her voice cracking as she shouted for extraction that never came. She remembered finishing the surgery alone under gunfire because there was no one else. That was the day they called her the Wraith surgeon. The day she stopped being human and became a story whispered across bases. The medic who never lost a man but lost herself. A knock pulled her back. Marlowe stood at the doorway, his expression unreadable. You still haven't told me the truth, he said quietly. She didn't turn. You wouldn't believe it. Try me. Maya looked up. You ever wonder why the SEALS never talk about their medics? He frowned. Because everything they do is classified. She nodded slowly. That's one reason. The other is that most of them don't make it home. Marlowe's throat worked, but no sound came. I wasn't supposed to either, she said, but someone had to keep the stories alive. For a long moment, silence filled the space between them. Then the intercom buzzed again, the calm, steady tone that followed every major trauma alert. Critical update, came the voice from upstairs. Lieutenant Cole Anders is regaining consciousness. Maya froze. The SEAL. Marlowe met her eyes. Looks like he wants to meet the nurse who brought him back from the edge. She set down her coffee. Then, I'd better go remind him what edge that was. The hallway lights flickered as she walked toward the ICU, the storm outside breaking again. In the bed ahead, the lieutenant's eyes fluttered open. confusion meeting the first face he saw, and when he whispered her name, it wasn't Nurse Whitaker. It was her old call sign, the one she hadn't heard since the day she vanished. "Wraith," he rasped. "They said you were gone." Her hand froze mid-air, the colour drained from her face. "Rest now, Lieutenant," she said softly, but her pulse was pounding. Because if he remembered her, others might too, and that meant the past she'd buried wasn't buried anymore. The ICU monitors hummed softly, their rhythmic beeps marking time like a metronome for tension. Lieutenant Cole Anders lay pale beneath crisp white sheets, an oxygen line trailing from his nose. The room smelled faintly of antiseptic and adrenaline, the scent of survival. Maya Whitaker stood at his bedside, arms folded, watching the rise and fall of his chest. His pulse was steady now, his breathing even, but the way he'd looked at her, the way he'd spoken her call sign, haunted her more than any battlefield ever had. From the doorway, Dr. Marlowe's voice cut through the silence. "He asked for you again." Maya didn't move. "He shouldn't be talking yet. He's lucid, and he knows who you are." Marlowe stepped closer. "Care to explain why a Navy SEAL officer from an active operations unit knows a nurse from Chicago?" Her gaze remained fixed on the monitor. "He doesn't know me." "Not anymore." Marlowe frowned. "He called you Wraith. I checked the DoD database." He hesitated. "That name's connected to a SEAL medical division. Black file. No access without Pentagon clearance." Maya turned sharply. "Then stop looking, Doctor. For your own good." Before he could reply, the intercom crackled. "Dr. Marlowe, Nurse Whitaker, report to ICU room 3 immediately." They hurried down the corridor. Another patient, a civilian man, was coding. Paramedics shouted. Vitals, sweat, and chaos filling the space. BPs crashing, airways compromised, pneumothorax. Marlowe lunged for the tray. "Get me a 14 gauge." Maya was already there, moving with a precision that made everyone else seem slow. Her hands were calm, surgical, unflinching. In one smooth motion, she found the intercostal space and decompressed the lung. The man gasped, air flooding back into his chest. The monitor stabilized. The chaos melted into stunned silence. One of the residents whispered, "How did she even—" Marlowe cut him off, his voice low but intense. "Because she's done it before. More times than any of us combined." Maya removed her gloves. "He'll live." She started to walk out, but Marlowe caught her arm. "Enough," he said. "No more secrets." "Who are you really?" For a long moment she didn't answer. Then she met his eyes, and he saw it. The kind of pain that doesn't heal. The kind that only comes from saving people no one else could. "Once," she said quietly, "I was a combat surgeon attached to SEAL Team 6. My unit's last deployment was classified under Operation Riptide. We were stationed in the Gulf." Marlowe's expression shifted from suspicion to disbelief. "That was a covert mission, the one they said went dark." She nodded. "It did. We were ambushed. Most of my team didn't make it. I did, but the Pentagon buried the report, said I was KIA to keep the operation clean." He stared at her. "You mean the Navy thinks you're dead?" Her silence was answer enough. "Why come back now? Why hide as a nurse?" "Because the military doesn't forgive ghosts," she said softly. "And neither do I." Before Marlowe could respond, a sound interrupted them. A low, rasping voice from the other room. "Doc." It was Lieutenant Anders, awake, watching them. Maya turned, her heart pounding. He looked weaker than before, but his eyes burned with recognition. "I thought you were gone," he whispered. "They told us you didn't make it out of Riptide." She took a cautious step forward. "Rest, Lieutenant." He shook his head weakly. "You saved me once. In that storm. You stitched me up in the dark." His eyes glistened. I still remember your voice. Marlowe's breath caught. You were there. Anders nodded. She wasn't just our medic. She commanded the evac when our CO went down. Half the team survived because of her. Because everything they do is classified. She nodded slowly. That's one reason. The other is that most of them don't make it home. Marlowe's throat worked, but no sound came. I wasn't supposed to either, she said, but someone had to keep the stories alive. For a long moment, silence filled the space between them. Then the intercom buzzed again, the calm, steady tone that followed every major trauma alert. Critical update, came the voice from upstairs. Lieutenant Cole Anders is regaining consciousness. Maya froze. The seal. Marlowe met her eyes. Looks like he wants to meet the nurse who brought him back from the edge. She set down her coffee. Then, I'd better go remind him what edge that was. The hallway lights flickered as she walked toward the ICU, the storm outside breaking again. In the bed ahead, the lieutenant's eyes fluttered open, confusion meeting the first face he saw. And when he whispered her name, it wasn't Nurse Whitaker. It was her old call sign, the one she hadn't heard since the day she vanished. Wraith, he rasped. They said you were gone. Her hand froze midair, the colour drained from her face. Rest now, Lieutenant, she said softly. But her pulse was pounding. Because if he remembered her, others might too. And that meant the past she'd buried wasn't buried anymore. The ICU monitors hummed softly, their rhythmic beeps marking time like a metronome for tension. Lieutenant Cole Anders lay pale beneath crisp white sheets, an oxygen line trailing from his nose. The room smelled faintly of antiseptic and adrenaline, the scent of survival. Maya Whitaker stood at his bedside, arms folded, watching the rise and fall of his chest. His pulse was steady now, his breathing even, but the way he'd looked at her, the way he'd spoken her call sign, haunted her more than any battlefield ever had. From the doorway, Dr. Marlowe's voice cut through the silence. He asked for you again. Maya didn't move. He shouldn't be talking yet. He's lucid, and he knows who you are. Marlowe stepped closer. Care to explain why a Navy SEAL officer from an active operations unit knows a nurse from Chicago? Her gaze remained fixed on the monitor. He doesn't know me. Not anymore. Marlowe frowned. He called you Wraith. I checked the DoD database. He hesitated. That name's connected to a SEAL medical division. Black file. No access without Pentagon clearance. Maya turned sharply. Then, stop looking, Doctor. For your own good. Before he could reply, the intercom crackled. Dr. Marlowe, Nurse Whitaker, report to ICU room 3 immediately. They hurried down the corridor. Another patient, a civilian man, was coding. Paramedics shouted. Vitals, sweat, and chaos filling the space. BPs crashing, airways compromised, pneumothorax. Marlowe lunged for the tray. Get me a 14 gauge. Maya was already there, moving with a precision that made everyone else seem slow. Her hands were calm, surgical, unflinching. In one smooth motion, she found the intercostal space and decompressed the lung. The man gasped, air flooding back into his chest. The monitor stabilized. The chaos melted into stunned silence. One of the residents whispered, How did she even... Marlowe cut him off, his voice low but intense. Because she's done it before. More times than any of us combined. Maya removed her gloves. He'll live. She started to walk out, but Marlowe caught her arm. Enough, he said. No more secrets. Who are you really? For a long moment she didn't answer. Then she met his eyes, and he saw it. The kind of pain that doesn't heal. The kind that only comes from saving people no one else could. Once, she said quietly, I was a combat surgeon attached to SEAL Team 6. My unit's last deployment was classified under Operation Riptide. We were stationed in the Gulf. Marlowe's expression shifted from suspicion to disbelief. That was a covert mission, the one they said went dark. She nodded. It did. We were ambushed. Most of my team didn't make it. I did, but the Pentagon buried the report, said I was KIA to keep the operation clean. He stared at her. You mean the Navy thinks you're dead? Her silence was answer enough. Why come back now? Why hide as a nurse? Because the military doesn't forgive ghosts, she said softly. And neither do I. Before Marlowe could respond, a sound interrupted them. A low, rasping voice from the other room. Doc. It was Lieutenant Anders, awake, watching them. Maya turned, her heart pounding. He looked weaker than before, but his eyes burned with recognition. I thought you were gone, he whispered. They told us you didn't make it out of Riptide. She took a cautious step forward. Rest, Lieutenant. He shook his head weakly. You saved me once. In that storm. You stitched me up in the dark. His eyes glistened. I still remember your voice. Marlowe's breath caught. You were there. Anders nodded. She wasn't just our medic. She commanded the evac when our CO went down. Half the team survived because of her. Maya swallowed hard. That's enough. But Anders kept talking, his voice gaining strength. The Navy's been looking for you, Wraith. They think you know something about that mission, about what really happened out there. Her pulse quickened. That's classified, Lieutenant. He gave a faint smile. So's your life. Then his monitors beeped. A spike. A warning. Nurses rushed in, adjusting meds, stabilizing him. Maya backed away, her thoughts racing. Marlowe followed her into the hall. What did he mean? What do you know about that mission? Nothing you want to be involved in? He didn't back down. You think I can just pretend none of this happened? That I didn't watch you do battlefield surgery in a hospital? Pretend, she said sharply, because the second you stop pretending, they'll come for you too. The look in her eyes made him believe it. Hours passed. The hospital quieted again, but sleep didn't come. Maya sat alone in the staff locker room, head bowed, staring at the dog tag that hung from a chain in her palm. It wasn't hers. It belonged to her, CO, Commander Adrian Shaw, the man she'd promised to bring home. The man she'd buried in the sand when command ordered her to evacuate. A door creaked behind her. It was Marlowe again. You shouldn't be alone. She slipped the tag back under her scrubs. You shouldn't be here. I'm not leaving until I get answers. She looked up, weary but resolute. You want answers? Fine. Riptide wasn't a rescue mission. It was a retrieval operation. We were sent to extract a chemical weapon compound before enemy forces secured it. But what they didn't tell us was that the toxin had already been activated. Marlowe froze. Toxin? It was experimental, slow-acting, airborne. Her voice dropped. We neutralized it, but exposure left some of us different. Different how? She met his eyes. You ever wonder why my hands never shake? Before he could speak, her pager buzzed, a single urgent code. I see you. She bolted upright. Anders. They ran. When they reached the room, alarms were blaring again. Anders was convulsing, his monitors flashing red. The nurses tried to stabilize him, but it wasn't working. His heart rhythms collapsing, one shouted. Marlowe grabbed the defibrillator pads. Clear! Nothing. Maya's mind raced. It wasn't cardiac failure. It was the same neurological tremor she'd seen once before, years ago, in a tent full of poisoned operators. It's not his heart, she said. It's the toxin. Marlowe blinked. You said you neutralized it. Not all of it, she snapped. He must have been exposed again. Her eyes darted to the IV line, faint shimmer of residue at the edge. Someone contaminated his fluids. Marlowe paled. You're saying someone's trying to finish the job? She didn't answer. Her hands were already moving, flushing the line, injecting counter-agents from the emergency kit. The monitor steadied, faint but climbing. Anders groaned softly, opening his eyes. Wraith. Maya leaned closer. Who did this to you? He tried to speak, but only 2 words escaped before he lost consciousness again. Not over. The room went still. Marlowe turned toward her. What does that mean? Maya's expression hardened. It means someone from Riptide isn't done cleaning up the past. Outside, thunder cracked against the windows, lightning illuminating her face. For the first time, Dr. Marlowe realized the truth. This wasn't just a mystery from her past. It was a war still being fought in the shadows. The hospital didn't feel like a hospital anymore. Security guards lined the corridors. Federal agents waited by the elevators. Whispers followed every step Maya took. Somehow, the past she had buried under years of silence had found her again, and it was walking through the front door. Marlowe met her outside, ICU, his face pale. They're here for you. Who? She asked, though she already knew. The Department of Defense. 2 agents. One said he's from Naval Intelligence. Maya's jaw tightened. Then it's about Anders. He nodded. They said he's being transferred. Military custody. She glanced through the glass window. Anders lay motionless, still recovering from the toxin that had nearly ended him. He won't survive a transport, she said. He's barely stable. That's what I told them, Marlowe whispered. They didn't care. Before either could say more, the door to the ICU opened. 2 men in suits stepped in, their expressions unreadable. Nurse Whitaker, the taller one said, or should we say Lieutenant Commander Whitaker? Maya didn't flinch. That rank doesn't exist anymore. Neither did you, the man said flatly, until last night. Marlowe stepped forward. She just saved a Navy SEAL officer's life. What's this about? This is a classified matter, the agent said. We're here for her. And the patient. Like hell you are, Marlowe snapped. This is a hospital, not a military holding site. The agent ignored him and turned to Maya. You were part of Operation Riptide, the retrieval of a bioweapon compound. We have reason to believe the toxin that nearly killed Lieutenant Anders was derived from the same research. Someone leaked the formula. Maya's stomach turned cold. You think I did this? The agent didn't answer. We need you to come with us. Marlowe's voice hardened. She's not going anywhere. She's a civilian now. Maya put a hand on his arm, stopping him. It's all right, she said softly. If this is about Riptide, I need to know who's still out there. The agent's tone softened just slightly. Your unit's records were sealed. Most of your team declared deceased, but 2 survivors remain unaccounted for. One of them might have recreated the toxin. She exhaled shakily. Sure. The name felt like a ghost leaving her lips. The agent tilted his head. Commander Adrian Shaw. She nodded. He was my CO. We thought he died in the ambush. Marlowe frowned. You told me you buried him. I buried someone, she whispered. I didn't check the tags. The agent's voice grew clipped. We believe Shaw resurfaced under an alias. Medical researcher, Gulf Coast facility. The same toxin appeared in Anders' system. If he's alive, he's gone rogue. Marlowe looked at her. Then we stop him. The agent shook his head. This isn't your fight. But Maya's eyes hardened. It always was. Hours later, the hospital rooftop glowed under moonlight. Maya stood at the edge, wind whipping through her hair. The city stretched endlessly below. Marlowe joined her, holding 2 cups of coffee. You know, he said quietly, most people would run from this. I tried running once, she replied. Didn't work. He studied her profile. Calm, fierce, resolute. If you go back into this, you might not come out. She looked at him, a faint smile on her lips. Then I'll make sure someone does. A helicopter thundered overhead, spotlight sweeping across the roof. The agents waited by the landing pad. Maya turned toward Marlowe. If I don't come back, keep Anders safe. He knows too much. You'll come back, Marlowe said. You're too damn stubborn not to. She almost laughed. That's what my CO used to say. As the rotors roared, she climbed aboard. The city shrank beneath her, a mosaic of light and shadow. For the first time in years, she felt alive, terrified, ready. The Gulf Coast Research Facility was dark when they arrived. A storm rolled over the horizon, lightning flickering like flashbacks. The compound loomed, sterile, empty, humming faintly with generators. Thermal shows one heat source, the agent said, checking his tablet. East wing. Maya moved first, her boots echoing on the tile. The halls smelled like disinfectant and metal, the same as every field hospital she'd ever worked in. Only this one wasn't saving lives. It was experimenting on them. They found Shaw in the lab. His back turned. His hair had gone grey, but his voice was the same, cold and steady. You always were good at finding me, Wraith. She froze. Why? He didn't turn. Because no one listened. They wanted to destroy the research, not study it. The toxin wasn't meant for war. It was meant to heal. Controlled properly, it could neutralize cancer cells. I kept working on it. Maya's voice was low, trembling with anger. And how many people died while you perfected it? Shaw finally turned. His eyes were hollow. Collateral for progress. You, of all people, should understand that. I understand the difference between sacrifice and slaughter, she said. He stepped closer. You're still the same soldier. Still pretending you can save everyone. Not everyone, she said. Just the ones worth saving. Before he could respond, the agents moved in. Commander Adrian Shaw, you're under arrest for unauthorized possession of classified biological material. Shaw's gaze flicked toward Maya. They'll never understand what we built. I understand enough, she said. He smiled faintly. You always did. Then he stepped back, triggering the failsafe. The alarms blared instantly. Containment breach, auto lockdown. Move! Maya shouted, grabbing the agent's arm. Seal the exits. Marlowe's voice crackled through her comm. Maya? What's happening? Containment, she said, panting as smoke hissed from vents. It's the toxin. Get out! Not until it's neutralized. She sprinted to the control console, hands flying over the system. Warnings flashed red across the monitors. The toxin release was partial, localized. She could stop it, but only manually. Overrides jammed, she muttered. Then leave it, the agent shouted. She turned, calm amid chaos. I've done this before. Before they could stop her, she tore open the control panel and flooded the containment with sterilizing gas. The alarms died slowly, one by one, until only silence remained. When the smoke cleared, she was still standing, coughing, pale but alive. The agent approached, awe in his voice. You just saved everyone. She smiled faintly. That's what I do. 2 weeks later, St. Gabriel's new trauma wing opened. A plaque hung above the door. The Whitaker Initiative, in honor of those who fight for life beyond the battlefield. Marlowe stood beside her, watching the first patients roll in. You could have taken the Pentagon job, he said. I already have one, she replied. This is where I belong. From the corner of her eye, she saw Lieutenant Cole Anders in a wheelchair, saluting quietly before being wheeled out. Marlowe smiled. You think you'll ever tell them who you really were? She shook her head. They don't need to know who I was. They only need to know what I can do. He looked at her, admiration in his eyes. And what's that? She smiled softly. Save people who shouldn't still be here. Outside, the American flag fluttered in the wind, steady, unwavering, just like her hands. They called it riptide because it was supposed to wash everything clean. But some tides don't erase the past. They reveal it. If you believe heroes never really stop fighting, then subscribe. Because some battles aren't fought with weapons, they're fought with will. The morning sun filtered through the trauma centre's windows, casting long shadows across the polished floors. Maya stood in the supply room, methodically restocking shelves, a routine that had become her meditation, her anchor to normalcy. Her pager buzzed, not an emergency code, a message, conference room, 10 minutes. Desai. She exhaled slowly, checking her watch. Her shift didn't start for another hour. When she arrived, the conference room wasn't empty. Dr. Desai sat at the head of the table. Marlowe stood by the window, and in the corner, wearing dress blues, was a Navy captain she didn't recognise. "Nurse Whitaker," Desai began, gesturing to a chair. "Please, sit." She remained standing. "What's this about?" The Navy captain stepped forward, extending his hand. "Captain Michael Reeves, Naval Special Warfare Command. I wanted to meet the woman who saved Lieutenant Anders's life, twice." Maya didn't take his hand. "He saved himself. I just gave him the opportunity." Reeves smiled slightly, lowering his hand. "That's not how he tells it." He pulled a folder from his briefcase. "Your actions 3 months ago, both in this hospital and at the Gulf Coast facility, prevented a catastrophic bioterror event. The toxin Shaw had weaponized could have killed thousands. I was doing my job." "Your job ended when you left the Navy," Reeves said. "What you did went far beyond that," Marlowe interjected. "Captain Reeves came here personally to deliver something." Reeves opened the folder, sliding a document across the table. "A full reinstatement of your rank and military record. Lieutenant Commander Maya Whitaker, honourably discharged, with full benefits and recognition for Operation Riptide. Your death certificate has been expunged. Your service is now officially acknowledged." Maya stared at the paper, but didn't touch it. "I didn't do this for recognition." "I know," Reeves said quietly, "but the men and women you served with, the ones who survived because of you, they deserve to know you're not a ghost. You're a hero." Her jaw tightened. "The real heroes didn't make it home, which is exactly why those who did need to remember them. And you." He pushed the folder closer. "There's also an offer. We're establishing a new medical training program for special operations. Combat trauma, field surgery, crisis intervention. We need someone who's been there, someone who knows what it takes." Maya finally looked up, meeting his eyes. "You want me to train the next generation? I want you to make sure they come home." The room fell silent. Marlowe spoke softly. "It's your choice, Maya. But for what it's worth, you've already proven you can do both. Save lives here and honour the ones you couldn't save there." She looked at the document again. Her name, her rank, her past no longer buried. "I need time to think about it," she said finally. Reeves nodded. "Take all the time you need. But Lieutenant Anders wanted me to give you this." He handed her a sealed envelope. She waited until they'd all left before opening it. Inside was a handwritten note on Navy stationery. "Wraith, you told me once, in that storm, that every heartbeat we save is a promise kept to the ones we lost. I didn't understand it then. I do now. You kept your promise. Now it's time to let others keep theirs to you. The ghosts don't want you to hide. They want you to live. Semper Fi, Cole Anders." Maya folded the note carefully, slipping it into her pocket. Through the window, she could see the emergency bay. Ambulances arriving, paramedics rushing. the controlled chaos of saving lives. This was her battlefield now. But maybe, just maybe, she could have both. The Naval Special Warfare Center in Coronado, California, gleamed under the Pacific sun. Maya stood before a classroom of 30 Navy corpsmen, young, eager, terrified. She recognized that look. She'd worn it once. "My name is Lieutenant Commander Maya Whitaker," she began, her voice steady and clear. "Most of you have heard stories about SEAL Team 6 medics. Some of them are true, most are exaggerated. But here's what's not exaggerated: the responsibility." She paced slowly across the front of the room. "When you're in the field, you're not just a medic. You're a surgeon, a therapist, a chaplain, and sometimes," she paused, meeting their eyes, "you're the last voice someone hears. That weight never leaves you. But neither does the pride of knowing you fought like hell to bring them home." A hand raised in the back. A young woman, barely 22. "Ma'am, is it true you operated on Lieutenant Anders without anesthesia during an ambush?" Maya's expression didn't change. "It's true. He lived. That's what matters." Another hand. "How do you deal with the ones you can't save?" The question hung in the air. Maya's voice softened. "You remember them. Every single one. You carry their names, their faces, their stories, and you make damn sure their sacrifice wasn't in vain by saving the next one." She pulled out a small box from her desk. Dog tags. Not hers. Shaw's. Anders's, others from Riptide. "These belonged to people who trusted me with their lives. Some I saved, some I couldn't. But I carry them all, not as ghosts, as reminders. Reminders that every life matters. Every heartbeat counts. And as long as we're still breathing, we keep fighting." The room was completely silent. "You'll face impossible choices out there. You'll question yourself. You'll wonder if you're good enough. But I'll tell you what my CO told me. You don't have to be perfect. You just have to be present. Show up. Do the work. Fight for them." She set the tags down gently. "Now, let's get to work." St. Gabriel Trauma Center hosted its annual gala, a fundraiser for the Whitaker Initiative. The ballroom sparkled with lights, donors, and dignitaries. Maya stood off to the side in a borrowed dress, uncomfortable in anything that wasn't scrubs. Marlowe appeared beside her, offering a glass of champagne. "You know, you could at least pretend to enjoy this." She took the glass but didn't drink. "I'm a trauma surgeon, not a socialite." "You're both now." He clinked his glass against hers. "The initiative has trained over 200 medical personnel this year, saved countless lives. That's because of you. That's because of a team. A team you built." Before she could respond, a familiar voice called out, "Commander Whitaker!" She turned. Lieutenant Cole Anders approached, walking without assistance now, fully recovered. Behind him were 6 other men and women in dress uniforms, members of SEAL teams, all bearing the same insignia. "We wanted to thank you," Anders said, "all of us, for giving us a second chance." One by one, they saluted her. Maya's throat tightened. She returned the salute, her hand steady. "You earned it," she said quietly. "All of you." As they dispersed into the crowd, Marlowe leaned in. "Still think you're just a nurse?" She smiled, genuinely smiled, for the first time in what felt like years. "I'm exactly what I need to be." Late that night, Maya stood on the hospital rooftop again, the same place she'd stood a year ago before boarding that helicopter. The city sprawled below, alive with light and possibility. Her phone buzzed, a text from an unknown number. "Thank you for finishing what we started." "Rest easy, Wraith." "Sure." She stared at the message for a long moment, then deleted it. Some ghosts needed to stay buried, but not all of them. She pulled out the dog tags from her pocket, the ones she'd carried for so long, and slowly, carefully, she placed them in a small memorial box she'd created on the roof. A private shrine, a place to remember. Commander Adrian Shaw, the fallen from Riptide, the ones who didn't make it home. I kept my promise, she whispered to the wind. They're safe now. All of them. Behind her, the rooftop door opened. Marlowe stepped out, 2 cups of coffee in hand. Their ritual now. Thought I'd find you here, he said, handing her one. Couldn't sleep. Ghosts? She shook her head. Gratitude? They stood in comfortable silence, watching the city breathe. You know, Marlowe said eventually, there's an opening for Chief of Trauma Surgery. Board wants someone with field experience, someone who knows how to make impossible decisions. Maya raised an eyebrow. You recommending me, Dr. Marlowe? I'm saying you've already been doing the job. Might as well get the title and the pay raise. She laughed, a real, genuine laugh. I'll think about it. That's what you always say. And I always follow through. He smiled. Yeah, you do. The wind picked up, carrying the scent of salt from the distant ocean, the promise of storms and clear skies both. Maya Whitaker, former ghost, former soldier, forever healer, stood tall, no longer running from her past. She had found her place, not in the shadows of what she'd been, but in the light of what she'd become. A hero who understood that the greatest battles weren't always fought with weapons. Sometimes they were fought with will, with skill, with an unwavering refusal to give up. And sometimes the greatest victory was simply showing up, day after day, heartbeat after heartbeat, and choosing to save just one more life. The American flag on the hospital's roof snapped in the wind above them, steady, unwavering, just like her hands. If you believe that some wounds heal into wisdom and some scars become strength, share this story. Because heroes aren't born in moments of glory, they're forged in moments of choice. And Maya Whitaker chose to never stop fighting.